Thank you for joining us for this important conversation around mental health awareness for the neuromuscular community. Being aware of your mental health has become even more important during this pandemic. With last Saturday being World Mental Health Day, we look forward to focusing a conversation specific for the neuromuscular community. I'm Justin Moy, and I'm excited to be moderating today's conversation. I am a member of the MDA community and an MDA Alumni National Ambassador. I'm also currently a member of the class of 2022 at Worcester Polytechnic Institute. I'm honored to be joined today by Jessica Edwards and Rebecca Axline. Jessica is the Director of External Relations for NAMI, which is the National Alliance of Mental Illness. Rebecca is the Supervisory Clinical Social Worker at Houston Methodist Neurological Institute and is the social worker at the MDA Care Center in Houston. We are happy to have you here today.
Thank you.
We're excited to be here.
We are thrilled to have these experts with us today. Please understand they are not providing medical advice during today's program. Any decisions about your care should be made in conjunction with your medical professionals. We look forward to spending the next half hour answering your questions. Before we dive in, I would like to thank our Facebook Live supporters, Mitsubishi Tanabe Pharma Incorporated, Sanofi Genzyme, and Biogen for their generous support of today's program. To start the conversation, Rebecca, can you share with us what mental health is and how to maintain a positive mental health?
Thank you. A comprehensive definition of mental health includes our emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It can be discussed with much more complexity, but simply said, it affects how we handle stress, relate to others, and make choices. And it's a combination of biological factors, life experiences, and family history. When you talk about a positive or good mental health, that includes one's ability to function. That means doing those normal activities of daily life, to learn, to feel, and express a wide range of emotions, and to manage these emotions in a socially acceptable way, so you're able to form good relationships with others.
And Jessica, I know that NAMI focuses on mental health. Can you share what that really means?
Absolutely. So NAMI stands for the National Alliance on Mental Illness, as you said, and we're the largest grassroots mental health organization in the nation. And we really focus on all mental illnesses and overarching mental health, as you mentioned. A mental illness is a condition that affects a person's thinking, feeling, behavior, or mood. These conditions deeply impact day-to-day living, as Rebecca mentioned, and they also may affect your ability to relate to others. Mental health conditions are far more common than you think. 1 in 5 adults in the United States experience a mental health condition each year. And a lot of people are hesitant to seek help because they're afraid of the stigma and they're embarrassed to talk about them. So that's why it's really important that we break that stigma and feel free to talk about mental health as part of holistic health. And I'm so excited to talk about that today with you all because that's part of removing the stigma.
Well, thank you so much, Jessica. Now, isolation is something that we hear a lot about during this pandemic. Do you have any tips on how individuals can remain connected with others during this time of social distancing? How do you maintain relationships right now?
It's a really good question and very timely because of COVID-19, which has created so many physical and emotional challenges for everybody across the country. Technology is so wonderful, but it can also make things hard. Zoom fatigue is a real thing. Screen time and being cognizant of how much time you spend on the screen is a real thing. But it's better than nothing. Technology affords us the opportunity to connect. We know from research that only 7% of communication is accomplished through written word. So much more of it, a staggering 38% is voice communication and 55% is body language and visuals. So while there's no substitute for the in-person experience, FaceTime, Zoom, and Google Hangouts and things of that nature do create an opportunity to connect, and having that authentic conversation with folks is really critical when you're physically distancing. That way you're not emotionally alone.
Great suggestions, Jessica. Really good overview. You know, I've heard the term social distance be changed to physical distancing in an effort to
Yes.
articulate that we can still be emotionally and socially connected even when we can't be physically close to each other. You know, being wise about physical distancing during this time of COVID, in my opinion, is a good choice. I think we'd all agree. That said, I do become concerned, as Jessica was relating, when individuals isolate themselves emotionally from others. This may be a sign that they're having depression or overwhelmed with fear and anxiety, or just not able to connect with others. Some of the tips, as were talked about already, was learning simple technology, but being aware of how much you use that. Maybe reaching out to others instead of waiting to be reached out to. Explore opportunities for learning, even just simply setting a simple goal and then rewarding yourself when you do one thing. In my experience, I've learned Zoom. I've walked a lot of times with my golden retriever and met neighbors I never even knew. I've stayed in contact with friends, coworkers, with text, phone calls. I've explored church and education online, and even learned how to do Facebook Live, which I'm doing today.
Now, this current situation is bringing up a lot of stress and anxiety, and so we're hearing a lot about those topics. What are some strategies for helping to reduce those feelings of stress and anxiety?
Excellent question. Well, there are many strategies. One of the ones that I've heard about and used most often include naming the emotion or feeling that I'm having. It doesn't give it more power to name it, but instead it gives you permission to feel it. And then I remember that it's an experience that we've never encountered in our life. I don't know about you, but I've never been through a pandemic before. So it would be unrealistic to expect that we know how to do this perfectly, or we do it without stress or anxiety. I think if you're living on this planet, you have some stress in your life. And then now that you've named it and realized that it's pretty darn normal, set some realistic expectations for yourself and how you're going to manage it. So explore the ways that have helped you in the past, what I call your toolbox, and then also explore new ways, because something that had helped you earlier in your life with a particular stressful time may not work in this situation. So you may need to explore for new opportunities and experiences. And there are a lot of good resources, whether it's first responders, frontline staff. NAMI has some excellent resources, literature on mental health and disasters, just ways of taking care of yourself.
And Jessica, if you wanted to bring in some tips too.
Absolutely. I agree wholeheartedly with what Rebecca said. I think that was some really good advice. I would just, to piggyback on that, add on to make sure you're doing self-care. Make sure that you're taking care of yourself and nurturing yourself, however that may look for you. Some things that I often explore are using a weighted blanket, a stress ball, or some sort of slime or silly putty to kind of have something tactical in your hands. Lotion, candles, essential oils, anything that's just very soothing and nurturing. I also just want to reiterate that mental health is physical health. Eating well and following your doctor's nutrition guidance is very important. Getting outside, if you're able to, and weather permitting, of course, is critical. Going for a short walk or doing your at-home PT exercises, just staying active is very important in managing your stress and keeping your whole self well.
Mm-hmm. And now more than ever, though, we're concerned about things that are outside of our control, leading to all this stress and anxiety. How do you recommend people work with those situations when they may not be in full control of finding a solution?
It's a great question, and it's something that I personally work towards and struggle with, because I like to be in control, and so much about 2020 has been out of our control. I would suggest try to find things that you can control. How do you respond to a situation? How much media and social media do you consume? If you're working from home, set some boundaries, set office hours to prevent burnout and create some of that work-life balance that we used to get when we would leave our homes, and now everything we're doing is at home. I like to remind people that we're not all working from home, we're all at home during a pandemic trying to work, and that's an important distinction for just kind of, like Rebecca said earlier, identifying what you're able to control and focus on that rather than all the things that are out of your control.
Right, right. Excellent. And Jessica and I could preach the same story, because it really is an illusion that we have control over everything in our lives, because it's too scary to think that some things could happen without our control, but in reality they do. And trying to control things might not be as effective as setting realistic expectations. For example, when I choose to wear a mask, I am in control of that situation, that decision. When I choose to avoid large crowds, I'm making a choice. Seeing a therapist, learning mindfulness techniques, using slime or weighted blanket, eating well, exercising, all of these things are in our control. And if there's a problem that needs to be fixed, we can explore what we can do, but also reach out to the greater good and the friends and families and healthcare folks to assist. We hear it said often, but it takes a village, and this situation is no different.
That's right.
Definitely. Yeah. And on that point of taking a village, especially with the neuromuscular community, caregivers are an important part of that village year round. And especially during this time, they're essential to the neuromuscular community, as our community has more risks associated with COVID. What are some strategies that caregivers can use to help them with their own mental health?
Caregivers report to me that they're exhausted and overwhelmed. At the same time, they're very concerned about the people they care for, and they're not feeling comfortable to bring in other people in from outside or get respite for themselves. So I think having a safe space for people to talk about these feelings is important. Online support groups have become very popular. In my role at Houston Methodist and the MDA clinic, I spent a good deal of my time on the phone or talking to individuals, giving them a safe space to problem solve and feel that they're not alone. Likewise, those living with a neurological issue need that same type of respect and space. We all need to be talking about, the stress in our lives and how we're feeling.
Yeah, absolutely. I mean, the same could be said from the NAMI perspective too. We focus a lot on the caregiver because they're such an integral part of the care team, and you have to put your oxygen mask on first before you can care for someone else. So you have to make sure if you're a caregiver that you are doing self-care, that you're seeking support for your mental health, and that you're able to keep your head above water so that you can care for your loved one. You can't pour from an empty cup.
Mm-hmm. Definitely. And earlier, I know, Jessica, you mentioned weighted blankets. But are there other steps that caregivers can continue to focus on themselves during this time? Rebecca, if you wanted to jump in with this.
Sure. The first thing I suggest, just like you mentioned, that Jessica mentioned, that you can't come from an empty well, that instead of trying to fit in times of self-care, don't wait, but make them part of your journey, because you're not only taking care of yourself, you're also modeling to the person you're caring for that importance. And the more everyone can be on board with, let's take care of ourselves first so that we can take care of others, I think that's very important.
Mm-hmm. Wonderful. And on that note, again, we keep on circling back to COVID, but it's so ubiquitous now. COVID has caused changes for all of us, including children. And with kids being forced to adapt to new scenarios, do you have strategies for how parents can continue to encourage and focus on their children's well-being as well?
I wish I had a perfect answer, but one of the things I want to say is I do believe that our children are resilient. History has shown us that children who grew up during wartime, financial depression, other negative experiences do thrive when they have a solid base of adults who care, believe in them, and normalize that it's a difficult time for everyone. They encourage flexibility and adaptation and look for creative ways to adapt. My biggest fear is that there might be a self-fulfilling prophecy that this generation of children will somehow be stunted for life because of the pandemic. I think it's really important to do things, but also to believe in our children and to model that resilience.
Mm-hmm. Definitely. And Jessica, if you wanted to jump in here too.
Yeah, absolutely. I mean, I think Rebecca raises really good points. There'll be a link in the chat of a recent webinar that NAMI did with an expert about children returning to school. So some of you may find that resource helpful. And we have other resources for parents of young children to take care of their mental health. And just if you're not sure what's a mental health condition versus just kind of quote unquote normal anxiety and stress during the pandemic, I would encourage you to check that and other resources from NAMI out as well.
Definitely. And going into something a little bit more serious, all this anxiety, stress, change can lead to depression. And depression is something that we often hear about across the spectrum of adults, youths, caregivers, and loved ones. Can you share what the signs and symptoms of depression are and when someone should seek help out?
Absolutely. I mean, just like we said at the very beginning, if you're struggling or someone you love is struggling, please feel free to seek help and reach out and ask for that support, because there's absolutely no shame in doing so. And you're going to help everyone around you if you take care of your own mental health. Depression can present different symptoms depending on the person, but for most people, the changes function how they operate day to day, typically for more than 2 weeks at a time. Common symptoms include change in your sleep patterns, change in appetite, lack of concentration or energy, disinterest in things that you used to enjoy is really common, hopelessness or guilty thoughts, changes in movement, physical aches and pains, and of course on the most serious end, suicidal thoughts. So absolutely, if you or someone you love is experiencing any of these, seek help. And there are tons of resources out there, and you're not alone. You're not the first person to feel that way. It's okay to feel that way, and there's tons and tons of resources and help for you.
Thank you so much, Jessica. And, Rebecca, if you wanted to talk on this point as well.
I would just articulate that what she's covered is exactly what I would encourage, that no one needs to feel alone. And if you're concerned that something is going on, it's better to over communicate and over seek resources than under.
That's right.
Mm-hmm. Mm-hmm. And also, loss and grief can also become part of this as well. And whether it's the loss of having in-person interactions all the way to the loss of a loved one, Rebecca, do you have suggestions on how to deal with these feelings of loss and grief?
You know, we are all grieving in different ways and sometimes for different reasons. But as a collective, we are experiencing many of the characteristics of grief, while not always honoring that grief. Back to that, we've never done this before. Sometimes we forget to honor that we are grieving. This is an area I'm very passionate about, so I don't want to talk too much, but I do believe that when we take the time to honor that we're grieving and allow that full spectrum of feelings and expressing emotions, we are more able to regulate these emotions. It kind of frees us from getting paralyzed or stuck in our grief and open up to creative ways of finding joy in the midst of sorrow. Life is really about both, and 2020 will have moments of joy as well as sorrow. We may also down the road find meanings in the losses, but just not necessarily today or this year.
Definitely. That catharsis is so important, right? And Jessica, that grief and stress, that's so powerful. So what do you recommend doing about it?
Yeah, I mean, I think Rebecca had a really great point, and I'm loving the way that you're acknowledging that you need to have space for it. And I think that you need to not ignore your body's response to your emotions, whether that be stress, depression, anxiety, or grief. I think that our mind and our emotions are really powerful, and when we ignore them, they can have physical manifestations, and it's just super important to be in touch with that and to vocalize that and to make sure that you're treating your whole self.
Mm-hmm, mm-hmm. And now, Jessica, I know that NAMI has a lot of resources. So what are some of those resources that you would recommend to support someone's mental health?
Absolutely. Well, I could talk all day about this, but I won't. So I would encourage you to check out NAMI.org if you have any questions about your mental health or a loved one's mental health. We have a helpline, which is a warm line that you can call and get resources and information from. We have tips and guides for people who are experiencing a mental health condition, maybe for the first time or maybe, has experienced it before. And we have tons of resources for family members, parents of young children, military and veteran family members. So I just encourage you to take a trip on our website. There'll be some links specifically that I thought this community would find interesting in the comments. But like I said, if I could just hammer one thing home, it's that you're not alone, and that as soon as you seek help and find those resources, you're empowering others to do the same, and it's so important.
And Rebecca, I know that you probably have a lot of resources too, if you wanted to share a few.
Well, I think Jessica nailed it right there with that. I would just also look locally for some in your local area, community resource pages, specific ones for the neurological disease that you're dealing with. There are also specific ones to your medical insurance and behavioral insurance. Many companies have employee assistance programs. Schools do as well, the EAPs. They can offer several free sessions with a therapist. There are online telehealth therapists available. And recently, there's also some services that started with a monthly service you sign up for that you can contact someone. There are therapists in network with one's medical insurance, as I mentioned, and there's also hospital-based and community-based nonprofits that provide support and sometimes even therapy. I'm not currently in private practice, but if I'm meeting with one of the individuals referred to me by the physician and I feel that they would benefit from therapy, I offer to assist them in finding someone within their insurance coverage. I certainly recommend that you seek a licensed therapist, and there's several different professions, whether it's a social worker, a licensed professional counselor, a marriage and family counselor, a psychologist, or a psychiatrist. I think within the muscular dystrophy family and our care center at Houston Methodist, we always offer to them that connection, providing whether it's support groups or whether it's individual counseling when you see them, or again, as I mentioned before, referring them to someone in their community within their insurance coverage.
And I know, Rebecca, that you mentioned this, so I'm going to bring the question to Jessica now. If you want to talk to somebody, what are the types of clinical specialists that someone would be able to reach out for help and support?
Yes, absolutely. So there's a whole section on NAMI's website about finding a provider that meets your needs, and that can include cultural competency depending on your background. You want to talk with someone that you feel comfortable sharing with and that has similar experiences and background to your background and to the issues that you want to talk about, because that's going to get you the maximum impact. And similar to what Rebecca said, you want to make sure that they're within your insurance if that's something that you are participating in, and just making sure that you find the right fit. So finding a provider can be hard, but we have tons of resources on what that can look like. And I should also just specify too, NAMI.org is the NAMI national website, which is where I work, but there's also 600 local affiliates across the country, and we're in 48 states as well. So we have 650 local NAMIs, likely in a community near you too.
Thank you. And Jessica and Rebecca, before we wrap up, is there anything else that you would like to share that we did not have a chance to cover today?
I just want to say thank you for having me and for integrating mental health into this conversation. It has been a passion of mine since I started at NAMI that mental health is part of physical health, and that the more we separate that from a care perspective, from a payer perspective, from a society perspective, the worse off we are. So just having this conversation and continuing to ensure that people are aware of their mental health is so important to me. So I'm grateful for that and being part of the conversation.
Thank you, Jessica. Rebecca, is there anything that you would like to add?
Can I say ditto? I so appreciate being part of the conversation. This has been wonderful. Thank you.
Thank you so much, Rebecca. Jessica and Rebecca, that's all the time that we have today. But I would like to encourage those watching to take a look at the resources shared today and be active in supporting your mental health. I would again like to thank Mitsubishi Tanabe Pharma America Incorporated, Sanofi Genzyme, and Biogen for their support of this Facebook Live program. Thank you for attending today's Facebook Live event on COVID-19 and mental health. If you were unable to join the conversation, the recording will be available for playback on Facebook, as well as at MDA's website, mda.org. Jessica and Rebecca, I would again like to thank you both for joining us today and sharing the great information that you did.
Thank you.
Please stay tuned for additional community updates through MDA's COVID-19 response page, as well as on MDA's Facebook page. Thank you again for joining us today, and remember to take care of you and your mental health.